we're here today with Chris and Nico. Chris has brought Nico in to do an oral exam because we want to check his oral health. So first thing we're going to do is we're going to ask Chris a little bit about his history and what he eats at home. So what kind of food does Nicholas eat?
He's on dry kibble.
Oh, that's good. Okay, and what does he get as far as treats? Do we give him any bones or anything like that?
Well, we took him off the bones a couple of years ago because we've learned oral health is very important.
Good, that's very good. Very important to note because bones can cause fractures in some teeth, so we want to be aware of that so we can look for those problems. So the first thing we're going to look at is Nicholas's skull type. And Nicholas is mesiocephalic, and that means that he's got a medium length and width of his maxilla and mandible. Dogs that are brachycephalic will have a shorter and less wide mandible maxilla, and that can cause issues with dental care. Brachycephalic dogs often have crowded teeth and rotated teeth, and this can cause issues because it can lead to excess plaque and calculus buildup. There's also another skull type called dolichocephalic, and dolichocephalic dogs have a long muzzle or snout, as you would say. And some things that are common with dolichocephalic breeds, like for instance German Shepherd, would be that they have a smaller, shorter and a smaller mandible compared to their maxilla. And what happens there is, for instance, the canine tooth is very long, so what happens is the canine tooth will actually touch the palate on the top of the maxilla, and this can cause soft tissue trauma and even abscess into an oral nasal fistula, which is actually a hole in the hard palate that leads right into the sinuses, and that can be extremely painful for the dog. So skull type is a good thing to note because we're going to look for certain issues with certain skull types. So the next thing we're going to do in our oral exam, our extra oral exam, is we're going to look at symmetry. And what we do there is we're going to use both of our hands, one on either side, and we're going to palpate for symmetry. We want it to be even on both sides. If we feel a swelling on one side that's not there on the other side, that could indicate infection. And an area to note would be above the fourth premolar, which is right about here. And dogs often get abscessed in this area, and that can cause very painful problems for doggies. So with symmetry, we're just imagining that there's a line drawn down in between the skull and that everything is a mirror image to each other. So there's nothing that's out of the ordinary, no tumors, no swelling on Nico, so that's good. And next we're going to move on to his eyes. So with eyes, we want to do the same thing. We want to look for symmetry. So with Nicholas, we're aware of his history, and Nicholas actually had to have a surgery done and where his left eye lid had to be stitched up. So his right eye actually looks like it's protruding more than his left, but that's completely normal for Nicholas. Protrusion on one side of the eye, like if he hadn't had this issue before, I might be led to believe that this eye is protruding more than the other, and that could also indicate infection. We also want to look for discharge. We want to make sure that any discharge that's coming from the eye is not thick or purulent. Tears are okay, and a lot of little doggies have tear staining like Nicholas here, but that's completely normal for him, so that's good. Next thing we move on to is his nose, and same thing here, we're going to look for symmetry. We want both sides to be equal in size, and he looks good. We don't want to see any thick or purulent discharge here either. A normal, clear discharge is completely normal in all dogs, so we wouldn't have to worry about that. Nicholas looks good there. Next thing we're going to move on to is his lips. So we just want to look at his lips and noting the color. He has a black pigment there. We're just looking for any ulcers or sores, lesions, anything out of the normal. And that side looks good. Take a look at the other side. No lesions, no masses. Color looks good. Very good. And then we're going to move on to his TMJ, which is his temporomandibular joint. And this is located right about here. And this joint actually joins the top joint, the top arcade, the maxilla, and the mandible together. So how we test this is we're going to just open his mouth. Make sure he can open his mouth wide, which is good. Some dogs can get lockjaw, and that means they can only open their mouth a tiny bit. So Nicholas is okay there. And lockjaw is a serious problem because that can seriously impede the animal's ability to eat properly. And then what I like to do is I like to keep one hand on this side of the joint while I open, and I'm just feeling if there's any crepitus. I want to know if there's any kind of creaking there when I'm opening the joint. And we do the same thing, and that feels good. So it looks like there's no issues with this TMJ, so that's great. And the last two things we're going to move on to is his lymph nodes and his salivary glands. So we're going to palpate his lymph nodes first. We want to do one on each hand, and you got to kind of dig for them, but they're down in there. And we want to make sure that each lymph node is the same size. If one is bigger than the other, then that can also indicate infection or pathology there. So Nicholas seems to have perfectly normal lymph nodes, both in size and in symmetry. And then right behind his lymph nodes, there's going to be a bigger gland that's called the salivary glands. And those are much bigger than the lymph nodes. We're also going to be palpating for symmetry and size. We want them to be equal. Sometimes you can get atrophy of one salivary gland on one side. So we want to, if we feel that, we want to look into that further and make sure there's no pathology there. So Nicholas looks perfectly good for his extraoral exam. And next we're going to move on to our interoral exam. So for our interoral exam, first thing we're going to do is with the dog's mouth closed, we're going to look at his occlusion. And occlusion is the way his teeth sit together, where the top and the bottom teeth sit together. So we want to look first at his incisors, and as you can see there, Nicholas's top incisors don't actually sit over his bottom incisors. So that means he has a little bit of a malocclusion there. It could be that he has a prothogenic maxilla, which means that the maxilla is set back a little bit further than the mandible. Because normally those incisors would just sit right over the bottom ones, the top ones would. But it doesn't seem to be impeding his occlusion any, so for Nicholas that's going to be okay. We just want to note that. That might be areas where there might be a little extra plaque and calculus buildup. Next we're going to move on to his canines. And with the canines, you see the bottom one, the mandibular canine, sits right in between the top canine and the top third incisor. And this is perfectly normal. This is exactly what we want to see. We don't want that bottom canine to be in the mouth or sticking out too much. So that's good. We're going to check the other side. Perfect. So that's completely normal there for Nicholas. Next thing we're going to do is look at his premolars. And his premolars are the ones just behind the canines. They have 4 on the top and 3 on the bottom. And with premolars, the way they should sit is kind of like a set of pinking shears. So the premolar on the top, the point of that is going to sit within the little V that the premolars on the bottom create, which is what we want to see. So let's take a look. And Nicholas is off a little bit. As you can see, if he could completely close his premolars into each other, they wouldn't sit perfectly. So that probably is indicated from his prophnogenic maxilla. But it doesn't seem to be hurting his eating habits any. It's just something that we're going to note. Next thing we're going to do, just want to check the other side. And he has the same malocclusion on the other side with his premolars, so that's evident there as well. Next we're going to look at his carnassial teeth, and those are the really big ones in the back. And Nicholas's upper carnassial covers his bottom carnassial, and that's exactly what we want to see. Some dogs will have a malocclusion where the bottom carnassial tooth sticks out buccally towards the cheek compared to the top one, and that can create a lot of excess plaque and calculus buildup on that bottom bottom mandible. So we're going to take a look at the other side. Good boy. Perfectly normal. That's good. And then lastly, we're just going to take a quick look at his molars. And they look good. Yes. Okay, so next we're going to move on to our mucous membranes, and our mucous membranes are is right up in here. It's not the tissue that surrounds the tooth, but it's the tissue up here, which is actually the inside part of his lip. And we're just looking at color. We want to make sure they're nice and pink. We want to look for any lesions or ulcers. Some big dogs have a tendency to have splinters or little things stuck in there, so foreign bodies could be something we might see. Nicholas has a nice even color, so there's no areas where there's any redness there, so that looks good. We're going to check the other side. Nice even pink color, no ulcers. That's terrific. So next we're going to move on to his gingiva, and the gingiva is actually the tissue that is right above his teeth. And when we're looking at the gingiva, we're going to be looking for recession or hyperplasia. So in the dog's mouth, there's a line there where we want the gingiva to sit. Sometimes they can get recession of gingiva, which means there's more of that tooth bone exposed than there should be, or hyperplasia, which means the tissue is growing down over the tooth. With recession, that can be a real issue because that can lead to bone loss and excess subgingival calculus and periodontal disease, so we want to keep a good eye on that. And Nicholas doesn't appear to have any hyperplasia or recession, and there's no redness, so there's no evidence of gingivitis there, which is good. And we're just going to take a look at the other side. Not too bad. We have a bit of redness on his canine right there on the left side, so we're going to fix that up when he gets his dental cleaning. So after we've looked at our gingiva, we're going to actually count the teeth, and we're going to take a closer look at the teeth. So I'm going to start with his maxilla, which is this top part of his mouth, and I'm going to count with his incisors. So he has 1, 2, 3 incisors. That's a normal number. He has his canine. Wait, I have 1, 2, 3 incisors. We actually have an extra canine tooth there on the top. So as you can see, that's okay, buddy. He has his canine tooth right there. Okay, yeah, that's a good boy. And then he actually has another one right there. So we have 2 canines. That's probably a retained baby tooth. So that's something that we might want to consider having extracted. We'll take rads of that to look and see what the pathology is there, if the tooth is sound in its bone structure or not. So then we're going to check the other side. So we have 1, 2, and we have the same thing on the other side of Nicholas's mouth. So he also has a retained canine on that upper side as well. His canine is there, that's good. Now we're going to take a look at his premolars. He has, okay, 1, 2, 3, 4. He has all his premolars on that side. And take a look at the other side. And he has 1, 2, 3. So he's missing a premolar on his left side as well. And lastly, we're going to try to get a look at his molars in the back, if he'll let us. Okay, we got 1.
It's okay, Piggy.
We got 2. So he has his molars on the top. So just a couple abnormalities that we noted there. The retained canine teeth and that missing premolar on this side. So next we're going to move to our mandible. And we're going to count his incisors. So he has 1, 2, 3 incisors. Has his canine. 1, 2. He's missing a premolar on his right side of his mandible. Carnassial tooth is there. Okay, take a look. I know. We have 1, 2, 3 incisors. We have a canine. Yeah, good boy. 1, 2, 3. So he's also missing that same premolar on his mandible on the other side there. And then the last thing we're going to look at on his bottom, on his mandible, is to see if he has those molar teeth in the back. Good boy. Yes, you are. He has 1 on that side. Oh, I know. I know. So it looks like he's missing both of his distal mandibular molars as well. And that could be something that maybe he was born with, or it also could be that they're retained underneath the gum line. So that's something we would want to x-ray. So we would ask you if it's okay, if we could do x-rays to make sure if they're truly missing teeth or not, and then we can determine what we're going to do about it from there. So once we're done with the teeth, we're going to take a look at his tongue. So we want to just take a look and see. There's no ulcers. Looks good. And he'll let us look at the bottom. I know nobody likes this part.
It's okay, baby.
Yeah. Okay, okay.
Okay, honey.
Yes. Good boy. Okay. Well, from what we can see, doesn't look like he has any ulcers or inflammation there, so that's good. And then after we look at our tongue, we're going to look at the hard palate. So we're just going to open it up and look at the top. You can see in dogs they have a little pattern on the top of their mouth, and that's called rugae. So in large breed dogs, we're going to pay attention there because sometimes they can also get foreign bodies lodged in there, and with cats as well. So that's something to note. Good boy, yes you are. And also something to mention is with when you're checking the gingiva in the mouth, especially with cats, because cats have a greater instance of resorptive lesions, and sometimes you can't see them on the gum line. So what we'll do is we'll just run the Q-tip along the gum line and see if it elicits a pain response. So there could be a resorptive lesion there that we're not seeing. And a resorptive lesion is kind of like a cavity that starts, and instead of it just staying open, the gums will kind of grow into the cavity, so it kind of covers itself up, and they can become abscess and cause a lot of pain. So that's something we want to make sure. looks good. Very good. Yeah. What a good patient. Good boy.
Very good boy.
Yes. Good boy. No pain response there, so that's very good. So while I'm doing my intraoral exam, counting teeth, I'm also looking at calculus buildup and plaque buildup, and that's going to give me an idea of the teeth I have to work on when we put him under anesthesia for his cleaning, and of his carnassial teeth in the back have quite a bit of calculus. So once we get him under, we'll get that all polished up and cleaned up, and Nicholas will be good as new. So we want to give our patient a cookie.
Well
because he's a
deserved.
good boy. And we want to say thank you to Chris for bringing Nico and letting us do an oral exam. And we hope that you all take dental care very seriously, not only for yourself but also for your pets. And remember, the number one thing that you can do to help your animals is to brush your teeth daily. Thank you.
Thank you.